My name is Caitlin Rublee. I am the current Living Closer Foundation Climate and Health Science Policy Fellow and a clinical instructor of emergency medicine at the University of Colorado. Today, we are going to talk about building healthcare facility resilience in the setting of disasters and climate change. Objectives are here to recognize the economic and health consequences related to extreme weather events, to identify previous and future climate threats to acute care hospitals and emergency care service delivery, to learn what resources and toolkits are available to guide hospitals, and lastly, to take steps towards adaptation and resilience building in the emergency department. I wanted to start here. This is a picture of a home. And for many of us, home has a special meaning. So what makes a home to you? In talking to many colleagues and students, they'll say it's the protection it provides against external dangers. Perhaps it's the roof over the head to protect against rain and wind. Some may say it's the electricity that provides lights even in the middle of the night. Others enjoy the climate-controlled settings, while others may talk about the roadway that connects to a myriad of people and places outside of their home. Whatever it may be for you, I think there are many parallels with our places of employment. The emergency department too needs safety and security. It needs walls and structurally sound roof to protect us against weather elements. It needs essential medications and supplies so that we're able to provide high quality emergency care services. In both high, middle, and low income settings, there are foundational elements for us that are necessary in order for us to provide care. Now, it may look a bit different in resource constrained settings, but many items are still needed in order to support patient care and protect us as employees. Now, why is this important? According to the leading scientific body on climate change, the Intergovernmental Panel on Climate Change, their report mentioned this. Direct and insured losses from weather-related disasters have increased substantially. Impacts from recent climate-related extreme events such as heat waves, droughts, floods, and wildfires reveal significant vulnerability and exposure. Climate-related hazards exacerbate other stressors, often with negative outcomes for livelihoods. So take food security, for example. A hurricane could come by and destroy a crop, such that a community no longer has access to local sustainable foods. Malnutrition rates may go up. Indirectly, the crop loss influences food prices, which influences other livelihood matters and families. Now, both urban and rural areas will be impacted. Just in the United States, looking at billion-dollar disasters, there have been 5 consecutive years with more than $10 billion disasters. You can see here in 2019, it ended about 14. In total, over the last 5 years, there was almost $70 billion disasters. Now, looking at the events that occurred in 2019, you can see they're geographically diverse. On the West Coast, there were wildfires. On the East Coast, there were hurricanes. There was also floods, thunderstorms. And all of these events impact human health. Many of the patients we see in our emergency departments present with these conditions. And in the middle here, according to the Center for Disease Control and Prevention, you can see more extreme weather events are one of the 4 major stressors of climate change. These events contribute directly to injuries and fatalities, but also adverse mental health impacts related to population displacement, for example. In addition, standing water remains and is a harbor for waterborne infectious diseases. Wildfires may increase and contribute to adverse air quality. Respiratory conditions such as asthma and COPD may be exacerbated. These are just a few examples, and I'm sure you can think of many more. Now, to the emergency departments and hospitals in which we work, there are direct and indirect impacts. Directly, infrastructure can be damaged. Energy systems may be disrupted, such that electricity is no longer continuous or able to be relied upon. Supply chain interruptions occur. And throughout all these episodes, patient care is influenced. Taking a step back and looking at the World Health Organization Emergency Care System Framework, we focused here on facility level threats. But as you can see, there are multiple potential areas of vulnerability when it comes to disasters impacting emergency care systems. We have the facilities down here, but we also have transportation and scenes, such that dispatch system, for example, is non-functional. So what are we going to do about it? When it comes to these threats, the Intergovernmental Panel on Climate Change describes resilience building. And here's how they define it. The ability of a system and its component parts to anticipate, absorb, accommodate, or recover from the effects of a hazardous event in a timely and efficient manner, including through ensuring the preservation, restoration, or improvement of its essential basic structures and functions. Now, what's important in this definition is the bottom line. How do we ensure our emergency departments remain operational to provide basic functions in order for us to provide high quality acute care services? That's what healthcare facility resilience is. Now, just to summarize everything we talked about, we're seeing an increase in extreme weather events and disasters that threaten healthcare facility operations and human health directly and indirectly. Emergency care services are challenged by resource limitations and surges in demand. And places that already have resource limitations are even more challenged. Weak health infrastructure and poverty, as well as other social determinants of health, exacerbate these issues. And many locations are particularly susceptible. Maybe it's due to their location along a coastal area. Perhaps it's susceptible to climate-sensitive diseases such as Lyme disease, Zika, chikungunya, dengue. Or maybe it's the socioeconomic activities that are relied upon by the community. Regardless, these events are causing destruction and disruption of our ability to provide care. Next part, I just wanted to provide 5 case examples of extreme weather events, just to give you an idea of what kind of impact these events have already had on hospitals, primarily in the United States. Case 1, wildfires. 2018 was a terrible year for wildfires. There were more than 58,000 that occurred just in the United States, burning millions of acres. Many of you have heard about the Camp Fire in California. Perhaps some of you have seen the documentary Fire in Paradise. Well, Feather River Hospital was one of the hospitals impacted with evacuation of 280 people. Looking at this picture, you can imagine having a hospital in the middle of that and what that would look like for you and your patients. This is just a map of the large fire occurrences, and you can see they occur from coast to coast. Even in the Midwest and along the East Coast, which are less affected by these large fires, they are impacted by poor air quality. So many fires occur north in Canada here and cause adverse impacts to air quality in these Midwest regions, as well as along the East Coast. If you'd like to read more about some of these impacts, here are 2 resources that you can check out. Case 2, Hurricane Maria. Now this hurricane occurred in 2017 and it hit Puerto Rico. But it turns out Puerto Rico is the largest foreign producer of pharmaceuticals for the United States. We had shortages of intravenous fluids for well over a year secondary to this hurricane. And so even when international events occur, they can impact us significantly domestically. The third case is coastal flooding. The Medical University of South Carolina is in a flood-prone location. It is susceptible to routine flooding. This is one image just from a hurricane a few years ago, but sea level rise also contributes. This image is from the National Climate Assessment, and as you can see, they mapped out hospitals and their different vulnerabilities based on hurricane category to their hospitals and significant threats for the future. Now, I just wanted to remind you too that sea level rise, although more of a subacute process, is expected to cause migration of people as well. And so even if you are not situated along the coast, this recent article demonstrates the mass migration of people under predicted sea level rise in the future in the United States. Case 4, tornado. Joplin, Missouri was hit by an EF5 tornado and within seconds caused widespread destruction. What was supposed to be 96 hours of emergency supplies were used within 4 hours. Paper medical records were destroyed and there were at least 6 deaths. The estimated total cost was $980 million. Case 5, dust storms. This image is in Phoenix, and these large events contribute, as this one article demonstrates, an increase in healthcare utilization. And you can imagine people with underlying respiratory diseases such as asthma and COPD are at particular risk. Think about these giant dust storm events in the setting of increased drought and increased heat. There are also considerations when it comes to valley fever and disease transmission, as well as inhaler use and supplies available for patients. So what should we do next? That's the question. We're going to talk about this and give you a few resources so that you can tackle some of these issues either locally, nationally, or on a global scale. And I just wanted to remind you that climate resilient health systems are part of global health in supporting these systems. We'll talk more about this. According to the World Health Organization, there are 6 building blocks of climate resilient health systems: leadership and governance, health workforce, health information systems, essential medical products and technologies, service deliveries, and financing. And from these 6 building blocks, there are numerous other programs and preparedness initiatives. But I think they provide a foundation of how to think about these issues. Now for a few tools. What can hospitals do with your assistance as a healthcare professional? So the Smart Hospitals Toolkit is from South America and the Caribbean. And what it does is provide a hospital safety index and a checklist so that hospitals can better identify their vulnerabilities and come up with interventions that are feasible to them based on their ability to pay for them. And then have training aids and other facilitator guidance such that the interventions can be successfully implemented within their institutions. The World Bank Group Climate Change and Health Diagnostic is a second example. Now this is focused on countries to address specific climate threats. Madagascar was one example that successfully completed this initiative, and they focus on nutrition. What can they do to reduce morbidity and mortality for nutrition? And then it links it to funding in a portfolio. There are other examples over here on the right side. You can see an example of a low carbon building in Rwanda. And so what they did is collaborated to reduce energy consumption. And the interventions they had actually reduced costs by about $2 million and produced more than 4,000 jobs. In the United States, we have the Sustainable and Climate Resilient Healthcare Facilities Initiative. And you can go online, I encourage you all to do it, and click through various cases. Hospitals have successfully implemented some of these cases to address their own vulnerabilities and threats. Here's just one example at the University of Texas Medical Center. Tropical Storm Allison hit in 2001 and caused significant disruption to their healthcare service delivery. And so what they did is convened as a community and interdisciplinary group, and they implemented projects. They changed their energy location, and they installed floodgates as seen here, as well as widened the bayou to reduce flooding. When Hurricane Harvey hit several years later, their hospital was able to remain operational, and they were able to be there and provide the care that their patients needed. This is another example in Boston. The hospital used the latest climate science to predict sea level rise for the duration of the building. They elevated the ground level floor to match this. They put essential medications and backup power on the roof and above the flood zone area. And then they reinforced infrastructure against storm surge. Now, I briefly wanted to introduce this to you in case many of you are interested in the intersection. Most of our discussion has been on resilience over here on the right-hand side. Disaster planning, preparedness, backup generators, flood barriers, but there's significant overlap with sustainability or low carbon healthcare. So this partnership between building resilience and low carbon healthcare is called climate smart healthcare. And so in the US, where an estimated 10% of greenhouse gas emissions are from the health sector, sustainability is actually really important as a mitigation strategy for climate change. And then there are several areas in between where there's overlap. Just to give you an example of sustainability, I invite you to look up this article on being a climate smart emergency department. It proposes items such as, does your facility have a green team? Do you have a sustainability lead? Are you a member of an organization such as Practice Green Health? Do you have goals and benchmarks where you can reduce your own emissions? So where will you start? I just gave a whole bunch of examples, both locally and abroad. And there's a lot of opportunity for us to lead as emergency physicians. In our communities, we can talk about climate change and how it adversely impacts health. In our EDs, we can implement climate smart healthcare and interventions that reduce waste and reduce emissions. Within our healthcare systems, we can build climate smart healthcare, and we can be a proponent of new buildings that are climate resilient and retrofitting old buildings that have the same structural stability so that during times of disaster, we're able to provide care. Now, nationally, we can join the SAM Climate Change and Health Interest Group and become an advocate. And then globally, we can advocate for emergency care as a human right, which includes climate resilient health systems. So we are able to practice emergency care in all settings. So climate change is a public health and healthcare emergency. We talked about extreme weather risks. We talked about reducing emissions, climate smart healthcare. And next step, we need to invest in community resilience and policy initiatives as leaders and as advocates for our patients and ourselves as employers and employees. So thank you. I envision a world where we do build to last and where all emergency departments can be climate smart and climate resilient. so that we can be there when our patients need us during everyday operations and during times of disaster.